I'm Kristi Pelzel, Senior Correspondent with Today News Africa from Washington, D.C. Joining me is Andy Pattison, Team Lead for Digital Channels at World Health Organization, and Bruno Bowden, Volunteer Lead on the World Health Organization's new app. As I understand, the World Health Organization has created a COVID-19 app that's now in use in Nigeria. Can you tell me a little bit about that?
Sure. Thank you, Kristi. So we're very happy to release the app just before the end of the year in conjunction with the Nigerian government and the Nigerian Center for Disease Control. And the main thing that the app does at the moment is sharing a lot of information content. The project started, early March, actually, a week after my second son was born, with Daniel Kraft and Dean Hatchimovich. And through that, we got connected to Ray Chambers, who's the WHO ambassador for global strategy. And that connected us to Peter Singer and the larger community within WHO. And from there, we've been working with many wonderful and supportive people at WHO to make this project happen.
It's a COVID-19 tracking app, like a tracing app for infections, or is it an information app?
So at the moment, it's focused around information, but we've got a lot of plans ahead for how we can support testing, contact tracing, and then ultimately vaccine distribution. There's a lot of moving parts to that because it involves the acceptance and approval of the host government that uses the app.
And the World Health Organization has spearheaded this project. They have developed this app. Is that right?
Yes. So it's done with WHO's content. So all of the medical content is vetted and written by them. And then the app itself was developed by a large volunteer team. It's over 150 people involved around the world.
As I understand, Nigeria is the first country to deploy this app in. Why Nigeria?
So Nigeria, WHO has a great partnership with the Nigeria CDC and Chikwe Ihekwezu. As developers, it's slightly easier to launch as there's a very large English-speaking population in Nigeria. It's also a large country of 206 million people. But over time, we want to add a very large number of translations.
With regards to translations, I'd just like to make a point that we are working with the tech industry, the tech giants of the world, to help us translate all the content into dozens and dozens of languages. We're working with Facebook, Google, even companies like Tinder have joined forces with us and pro bono translating our content. Of course, WHO then has to check it, but that means that we can reach more people in their own language, and that's really important to us. People are much more likely to absorb information if it's in their mother tongue. So, we translate into the main European and UN languages very, very quickly, but there is a lot of languages and dialects that we need to tackle next, which is going to be a little bit trickier to do, but we hope to work with similar partners in Africa to get that kind of content out to people.
And how about the cost of the app to the consumer? Is there a cost involved?
Oh, no, it's very important that the app is free. We want it to do as much public good as possible. And that means, making it freely available and as useful as we can make it.
You said it's more of an information app and less of a tracking app at this time, and it may evolve into that. However, what type of data are you going to collect? Names, email addresses. What type of data are you collecting?
So at the moment, it collects very little, what we call personally identifiable data. So it knows, for example, your IP address, but it doesn't at the moment collect your name or telephone number or something like that. You don't need to create an account to use it. You can just use it.
WHO never collects health data on people. We may have data which will allow the app to be more easily used or personalized to the individual so that they get the best health information for their topic. But that data is never collected and never shared with anybody.
People around the world are hoping that we stop talking about COVID-19 and it's going to go away, but you're making this app. So, well, can this app, if there is another pandemic of some kind, could this app potentially be transformed to address different pandemics should they come out?
So, Kristi, that is one of our hopes. For example, vaccine development and therapeutics take time to develop and test through a very appropriate regulatory process. But one of the nice things about a digital app is that it's something that you can deploy immediately. And there is a lot of work as well that WHO does for early detection of new pandemic threats, and we hope that this could also be supportive of that too in the future.
That will range from local epidemics to regional problems to global issues. And what we'll try and do is to think globally and act personally on a very personal level for that person, depending on their demographic, their age, their sex, whether they're urban or rural, and what the big health issue is to that population at that moment. And that's what we think the power of the digital tools can help us identify, is get the right message to the right people at the right time so they can make good health decisions to live longer and healthier lives.
That's fantastic. That's awesome. You mentioned that this is a big collaborative volunteer project. Can other people join in and help, and how do people support this?
Kristi, that is something that we'd love to foster. And it's an open source project hosted on GitHub. And so it means that anyone can download, understand the app, and also contribute improvements as well. And we'd like to foster communities around the world, in Nigeria and every other country, so that they can help adapt the app to their local needs.
That's great. Thank you. Is there anything else that I haven't asked you today which is important for people to know?
The main thing one of the big messages I'd love to convey is to thank you to all of the 150 volunteers around the world that have, helped to build this app, and also everyone that I've worked with at WHO, from Ray Chambers to Peter Singer, Bernardo, and many others that have helped bring this into existence.
You may have seen a study from MIT where falsehoods are being shared 70 times more likely to be shared than accurate information. So a false story will reach 1,500 people 6 times quicker than a true story does. So false stories, unfortunately, outperform the truth in every single subject, including business, terrorism, war, technology, entertainment, and sadly, in our case, also health and science. So it seems that we simply cannot compete with hoax and rumor. Falsehoods travels faster, further, and deeper than the truth every time. So what we're trying to do with projects like this is to give people the sense of security that the information they're getting is correct and coming from a reliable source. We're working with the ministries of health in countries and the World Health Organizations with thousands of scientists around the world to bring people the best possible health information. Misinformation is one of the biggest problems that we have in our community at the moment. It is so easy to invent a bit of content and share it and watch it go viral. We all have a responsibility to curb that. So what we're trying to do at WHO is to share really good quality information, because falsehoods thrive in a vacuum. So with this app, we're hoping to get more truths into more people's hands and therefore also combat misinformation.
Thank you for speaking with me.
Welcome. Thanks for having us.